All right. Hello, everybody. I'm Brian, and this is AAMI News and Conversation. We're here for the first full day of AAMI Exchange in New Orleans during 2025. And I have two guests in the studio who I'm sure a lot of you recognize and know already. It's the leads of our AAMI Foundation, Janet Prust and Ralph Basile. So let's skip introductions. Everybody knows you guys. But
We'll still say good morning, Brian. How are you?
Janet, it's always good.
Welcome to New Orleans.
Yeah, welcome to New Orleans. But we should touch on AAMI Foundation. What is this for those who are going to be, I've heard the name before. I know it's related to AAMI, but I don't know what it does. What is it related to? So, Janet, why don't we start with you? What does it do?
So AAMI Foundation is actually a separate entity from AAMI. We're both AAMI and AAMI Foundation are nonprofits, but Foundation is dedicated to advancing the future of healthcare technology management, and we do that through different types of academic scholarships. We do it through honors awards, recognizing people who have contributed a lot over their career to what AAMI focuses on and AAMI's mission, and then more importantly, for today's conversation is we give out research grants to help fill some of the areas where there's missing data. So that's really going to be the topic of what we go through today. You know, the foundation has been in existence for decades, but we're happy to report that we've really in this last year have been able to do a lot more, and we're going to highlight that this morning.
Yeah. And, Ralph, I remember the first time I was talking to you to get a better sense of what the foundation achieves myself. You'd kind of mentioned how the foundation almost serves like an engine to move AAMI's mission forward. But there is that distinction that Janet pointed out because the engine needs very different fuel than what AAMI is normally using. So why don't you tell me a little bit about that? What are these grants doing?
Yeah, sure. I would say it gives the fuel is the basic research, the basic funding, whether it's for, again, scholarship, whether it's for research that can underpin developments that AAMI then moves forwards. I mean, we're very active in standards. So standards is a great example of that. We'll talk a little bit about some of the studies related to material sciences. And this happens to be really important right now in the development of some of the AAMI standards like TAR 17, for instance, related to sterilization modalities and compatibility of materials.
It's a big household name.
Yeah. So, the research that we're funding underpins that, that then provides the science-based evidence that you need to move those standards forward.
That's great. I love to see the references. And I'm a big science nerd. A lot of people, you guys know that. But I love to see when it's a massive reference sheet at the bottom of a standard, because then it's not only do they have the consensus of the experts in the room, but they know the research. They've been talking to the research, and we have that academic consensus as well. It's a truly consensus-based standard. Love to see it.
And in addition to that, the research also not only will support standards and making those recommendations for the state of the art, but it also, some of the research grants that we've done is it improves care within the hospital because it provides clinical evidence of what is the benefit and the improvement for the patient outcomes. So it's both of those things. It's kind of technical, supporting the standards, but it also can drive clinical practices to improve patient care.
Yeah. And I've seen also with especially these grants, a lot of them are going out to research teams for other associations, right? These grants don't always feed back into AAMI. In most cases, they don't. Like a good example is a ECRI research team that we'll be talking to later today with two really exciting papers I'm going to be excited to talk about. But Ralph, why don't you tell me a little bit about the most recent grant recipients?
Oh, sure. So we just got done going through the process with the Logan Fund, which maybe we can talk a little bit up to distinguish between Logan and Kilmer.
Oh, yeah.
But Logan goes back to 2016, and it was funded by AAMI in a grant directly to the AAMI Foundation. And the Logan grant, the scope is pretty broad. It has to do with the development and use of healthcare technology. Janet just alluded to this. It's a great example of the Logan's a great example of also improving practice. So one of the over the years, Logan we now have our fourth this year study related to the use of infusion pumps. And there's a lot of failures related to kind of the human factors interfacing with an infusion pump. So we have a study this year that's going to look at infusion pumps. But we've had 3 over the last several years that have looked to improve the use of infusion pumps. So that's just an example.
Sure.
Yeah, there's that opportunity to continue to build evidence because nearly every study always has questions at the end.
Every
They
study
all
ends
say,
with it. Yeah, go
more
ahead.
study is
More
needed.
study is needed.
It's one of the
It's the
conclusions.
nature of science, right? The
Exactly.
pursuit of more
Exactly.
information.
Yeah.
So that's one of the benefits of a Logan Fund is that they can continue to come back and build on previous research, and actually, we focus on that when we see those kinds of studies.
Another example too. It wasn't a study this year, but there's been 5 studies related to alarm fatigue,
Yeah.
primarily of healthcare workers, right? And again, that has to do very much with. I mean, it informs the development of those products, but it also informs the use of those products.
And
So-
for those who don't know, when we talk about alarm fatigue, we mean there's so many alarms going off, you kind of just start to ignore them or tune them out. It's just human instinct, right? We get used to things that happen.
tune them out, or it literally leads to fatigue. I mean that the
like burnout for
healthcare
the workers.
nurses, the healthcare workers just trying to react to every alarm going off or whatever, and there can be too much of that, as a lot of the studies have shown, and how to use it better. Yeah.
Yeah. So I know that you guys have been kind of spinning up. We're getting more and more grant applications, and you're trying to reach out to more and more different fields or experts that may not be aware of what the AAMI Foundation is doing. Why don't you tell me a little bit about that? What are the efforts going on here?
So one of the things we've been focusing on is really trying to identify what are the true gaps, right, in the areas that AAMI has a history with or has been interested in. So alarm fatigue and fusion pumps are certainly 2 really great examples of that. But what we did for our sterility assurance folks, we have a large standards program that Ralph mentioned around sterilization, sterility assurance, and that. So last fall, we held what we called a research summit. It's actually was a hybrid, and some people were in the room, but a lot of people were online, and we asked the group of experts, where are the areas where there are gaps in evidence? Where do we need data to be able to support standards, other types of things? And then Ralph is going to talk a little bit about one of those grants that we gave that support that around material science. Our plan is to do that right after exchange here with healthcare technology management professionals.
Great. Get
So
knowledge,
and
yeah.
ask them, where are the areas where there's gaps? Where do you need more evidence, either to design certain types of products or technologies, and again, things that actually affect clinical practice. What we found once we start, trying to build more awareness of things like AAMI Live and other interviews and other communications that AAMI Foundation has put out, is that there's a lot of people who have really good ideas on where there needs to be research. So we pulled that all together, and then basically what we do is we say we really invite research projects in these areas because we know that then the results of that are going to have a direct effect, and not 10 years from now, but hopefully within a few years. So we do focus on looking at grants and for projects that will have an effect sooner than later.
That's true. Quick turnaround, and then they can always come back again if there's a next.
Yeah,
step
when
in
they
that
want to build
research.
on.
You'll have Dr. Leva here a little bit later. He's a 2-time grantee that we'll talk to. So, yeah, and well, just to pick up what Janet was talking about, when we did that research summit, many people are very aware of the issues related to ethylene oxide sterilization and it being a carcinogen and literally traced to air. Neighborhoods.
Health problems.
Health problems, thank you.
Yes.
So there's 2 aspects to that came through the research summit, and one is looking at other sterilization modalities, such as vaporized hydrogen peroxide, which the FDA recently recognized as an industrial sterilization method. But there's a lack of research related to material compatibility with vaporized hydrogen
VHP,
peroxide
okay.
sterilization. And so there's a need to do that basic research. And so a research project was put forward, submitted for the Logan Fund, which the Logan Committee then did approve to do further research into materials and their compatibility, the effects of vaporized oxidizing agents of any kind are difficult on materials. So to look at the effect of that particular sterilization modality on materials to help move the industry forward, to inform all of us, the manufacturers of those devices, the manufacturers of those materials, and the users about the best use of it. I'm going to actually we alluded to the Kilmer Fund, but there's an issue with EO. And do we overuse EO? So there is a study that has been funded through the Kilmer Research Grant, which is focused on sterility assurance versus Logan, which has a much broader scope. But we're funding a study to look at EO residuals on materials, and then is there an ability through that research, perhaps to lower the concentration of EO that's being used in sterilization. Another way of addressing the hazards of EO,
And is this
reducing
tied
the
to
risk.
assessment, like overkill, things of that nature? Make sure it's
Can you still sterilize?
Can
an
you still
item with
sterilize?
less EO?
Right, yeah,
So
makes
you're
sense.
using less. There's less risk of exposure. There's less risk in the atmosphere. All of those kinds of things. So.
Right. Yeah.
But that's a really good example. So that not only addresses information that we need for the standards, but it gives directions to manufacturers of devices, because we're testing polymers and metals and things like that, and just about every device has one or more.
Yeah.
So it gives direction to the industry of how to redesign devices to make them compatible with these other types of modalities that have less risk associated with them.
Yep.
This will be another one. There'll be multiple over the years to continue to build on the research
for sure.
and the data.
Yeah.
That's fantastic. I love to
Yep.
hear about it. And for anybody who's listening to this and going, "Oh wow, that kind of sounds like what I'm doing," or "That's my research."
Everybody's doing it.
Everybody's doing it.
Everybody's thinking about it at least.
Applications then, to reach out to you guys for a Kilmer Fund or a Logan Grant. We'll have a link in the description, but you also said it would probably be best to reach out to you directly. So what's the email that people should contact you by?
Well, mine is rbasile@aamifoundation.org.
And mine is jprust, JPRUST at AAMI Foundation, one word.org. You can go on the AAMI go to AAMI website, type in foundation. You'll see it on the top ribbon. And
Our smiling faces
You'll
will show
you'll
up
find
with our
us
email.
there. Like technically, we're not in kind of application season. That typically opens in the fall, but we're happy to start working with anyone at any time, answering any
Yeah.
questions and putting together those applications.
Speaking of that, we're talking about the Logan and the Kilmer Fund, but there's also opportunity which the foundation has done in the past and can do in the future, and that is, we can also talk about projects that are outside of those, where there's funding that's specific to those projects that can go through the foundation. And this includes, we just introduced our in-kind donation program. So a vendor of services or materials or et cetera can do in-kind donation to a project. And the good thing for that is, one, that, of course, they get credit for helping the industry move forward, which is a big deal, right? And the other thing is that they are able to fully expense the charity at the retail price, I'm going to call it, versus the cost of the service. So we're happy to talk about those things. And that's definitely something to reach out to me or Janet on, because you won't find that that's the way to get it started, right?
Yeah, and you can also focus those in-kind donations as manufacturer or vendor then into projects of your particular interest.
I see.
Right, that's the key piece of
Right,
it.
yeah.
So the work around ethylene oxide laboratories, for example, will donate some of their resources to do some of the testing. Or organizations that have the sterilizers, they'll donate the time on the sterilizers to do the testing. So
So
when
the
we talk about
foundation is
in-kind-
essentially facilitating
Yes.
vendors who need specific research done connect with the researchers
Yeah.
who can do it.
Not around development of product, right? Whereas a huge advantage of working with the AAMI Foundation is it takes the commercial out of it, and it's to move the industry forward,
Yeah.
right? Not to develop an individual product, but yeah.
And would the research then be public information, or is it just to help them write up a better IFU, for instance?
Well, no, we want it
We wanna
published and shared.
Just about every application we do encourage, there needs to be some sort of deliverable that comes out of that.
Sure.
Typically, that deliverable is a publication in a peer-reviewed
Love to hear
journal
it.
of some
That's
sort.
that's the answer.
Like
I want.
BINT,
Yeah.
AAMI
Yeah,
BINT.
BIT, yeah. The standards, however, sometimes that data will go into a standard and then gets referenced. There's still a write-up from it, right?
Sure.
There's some sort of a paper that comes out of it, but it ends up being then a reference standard. And what's also interesting about those kinds of research programs is that they're often a collaboration between multiple manufacturers, even those that are competitors out in the marketplace, but they work together to be
all
able
ships
to...
rise.
Yeah, exactly, to be able to generate that data that's going to move
Move
the
the-
industry forward.
Yep. Yep.
Fantastic.
Yeah.
Well, again, I'll say it. People can find a link in the description to even, I know we're off season right now, but they'll reach out to you guys if they think they have a cool idea.
Yeah.
And
Great.
we'll get things moving forward. But Ralph, Janet, thank you so much for explaining a little bit more what the foundation's up to. I love to see the growth of this. I mean, we all love the science, so it's really encouraging.
Well, thanks for
Great.
having
Yep.
us this
Thank you,
morning,
Brian.
Yeah.
Appreciate it. Yep.